And yesterday, the Occupational Safety and Health Administration, OSHA, issued a rule to require employers with 100 or more employees to ensure that each of their workers is fully vaccinated or tests negative for COVID-19 at least once a week. And the Centers for Medicare and Medicaid Services issued a rule requiring that all workers at healthcare facilities participating in Medicare and Medicaid are fully vaccinated. Together, these rules, along with other requirements we've put in place, means that 2/3 of all workers in the United States are now covered by vaccination requirements. These requirements have broad public support, and they work. Already, we've seen organizations that have adopted vaccination requirements increase their vaccination rates by more than 20 percentage points, often as high as over 90%. This is good for the workers, for their colleagues, for their loved ones, and for their communities. And it's also good for the economy. In a recent University of Chicago survey, every economist agreed that requiring staff vaccinations or regular testing among large employers would promote the economic recovery that is faster and stronger even than it is now. Analysts at Goldman Sachs project that these kinds of requirements could lead to up to 5 million more Americans re-entering the workforce. That's because they feel safer to do so. It's because there are fewer disruptions to things like childcare. Again, beating COVID-19 remains one of the most important ways to strengthen our economy, not just save lives, but strengthen our economy. We're making progress. As of this week, 70% of American adults are fully vaccinated. More than 193 million Americans fully vaccinated. It was less than 1% when we took office 10 months ago. And one more piece of good news. Last night, we received promising news about another potent and potential COVID treatment, a pill developed by Pfizer that may dramatically reduce the risk of being hospitalized or dying when taken shortly after infection, if you're infected. If authorized by the FDA, we may soon have pills that may treat the virus of those who become infected. We have already secured millions of doses, and the therapy would be another tool in our toolbox to protect people from the worst outcomes of COVID. But look, it's important to remember, we need to prevent infections, not wait to treat them once they happen. And vaccination remains the best way to do that. The pandemic is not yet behind us, but within this week's announcements, vaccines for kids, more adults getting vaccinated, potential treatment for those who get sick, we're accelerating our path out of this pandemic.